This is the first tip in the series, How to Avoid a C-Section. So your first tip is choose your healthcare provider wisely. Welcome to the Hypno-Baby channel. I'm Dr. Nathalie Fiset. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. Hello, I'm Dr. Nathalie Fiset. In this series, How to Avoid a Caesarean, I'm not shaming people who have cesareans, who want a cesarean, and I'm not shaming doctors or anything like that. I'm just giving you some reflection, some pieces of reflection. First things first, there's a big difference in cesarean rate between doctors and between midwives. Midwives have around 10% cesarean rate, while doctors in the US have a 33% cesarean rate. So your first task, and don't be afraid, is to ask your doctor his cesarean rate. If you see that he's not answering or offended, that's kind of a giveaway that must be high. Okay. The other giveaway that the cesarean rate of that doctor might be high is if you talk to other patients in the waiting room and they all say, I've had a cesarean, I'm having a cesarean, we've planned a cesarean. Or if your doctor always has the word cesarean in all the sentences, that's another giveaway. Another giveaway, if you see your doctor at the hospital, is if he's always wearing those little booties that we wear in in surgeries or the shower cap. You know that this doctor is often in the OR doing cesareans. And there's some doctors that are always wearing scrubs. It could be because you deliver babies. So, but usually if they have the cap, it means he's in the OR a lot. If you go the other route, if you decide on having a midwife, you have to know that their cesarean rate is really lower, like in the 10% vicinity. There's a big bias though. The one thing is that they don't follow high risk pregnancy, so that lowers their rate of cesarean from that. Okay, so which, that's different. I personally, as a family doctor, had a lifetime cesarean rate of 10.1%. Okay, so that means I was working with gynecologists, and for many things, I had to do consultations. Let's say to do forceps, or if labor was not progressing, or if the baby's heart was showing decelerations, like the baby's heart was dropping. And since those gynecologists had 33% cesarean rate, and I still had 10%, 10.1%, it means I had to fight. So even though I did the consultation because that's the procedure at the hospital, I had to say, no, baby's fine, mommy's fine. And I was the hard-headed person at the hospital. I can tell you for a fact that when I saw who was on call, like on the board, we write the doctor's name. Some would be like a more uphill battle. I knew it. And some gynecologists would find like almost any reason to do a cesarean. I've had a patient, it's more anecdote, but had a patient that had a low placenta, which is one of the good reasons to do a cesarean, because if the placenta comes out before the baby, there's going to be hemorrhage. So it's super dangerous for the mom and for the baby. So this gynecologist does an ultrasound, and and the patient was coming to get an elective cesarean. So she checks and she goes, oh, the placenta is up. Of course, because at the end of the pregnancy, the baby's head comes down, so it kind of pushes the placenta up. So it's really rare that you still have a placenta, what we call previa, above the cervix at the very end of pregnancy, because the baby's head pushes it up and it never goes back down. And then the gynecologist was saying, well, it could go back down. It doesn't, because the baby's gonna push it up, and the uterus is growing. So it's like if you have a stain on your t-shirt and you're gaining weight, the stain is moving with your belly. But so the same thing, the placenta is being pulled up because the belly is growing, the uterus is growing. So it didn't make sense. And then she was saying, okay, well then, oh, the baby might not come down. And then, the baby, once the shoulders are out, the baby might not come out, which is ridiculous because the broadest part is the baby's shoulder. So, and eventually my patient said, yeah, okay, I was here for the cesarean, so let's do it. And there was no medical reason at this point. So I was really upset with that one. But it shows you that if a doctor wants to find a reason to do a cesarean, they can always find one. So you have to be, and my patient was not like arguing or defending her point much. So she kind of gave in her authority or her power. You might wonder, why is there so many doctors or even midwives or doulas that are like telling you how to avoid a cesarean? There's too much cesarean. Why are we saying this? Because it's true. And even the World Health Organization said in a statement that when you get to 10% cesarean rate, there's benefits for the mother and for the baby, because these are the cesarean, like we were saying, like low placenta, or if there's a uterine rupture. Let's say somebody had a previous cesarean and she's in labor and the uterus ruptures. Yes, it get the baby out, get the mother, give her a cesarean emergency. But these are rare cases. So what they also say is that above 10% cesarean rate, there are no benefits, no added benefits to the mother and the baby. So why are we at 33%? One big reason is fear of being sued. I went I was very excited. I went to a Harvard OBGYN obstetric gynecology convention, and I was like, oh my God, I'm going to learn so much. And sure enough, the first speaker goes, okay, you're going to get sued for this. I got sued for this. My colleague got sued for that. So it was all about malpractice and lawsuits. And I was like, and in my 25 years of medical practice delivering babies, I delivered 3,700 babies. I never got sued. So, and I'm Canadian, so we don't sue as much, but that's changing. But still, it was not in my mind, and I never did like defensive medicine. It was always in the best interest of the mother and the baby. And even though I had 10%, nothing happened. Okay, I did not have babies that were sick or sicker, or the mother that complicated. And actually, right now, I'm still spying a little on forums like pregnancy forums. And so many women say, my baby was in the NICU, my baby had trouble in it, and I never had a baby in the NICU in 25 years. Again, because we were not inducing, we were not getting babies out like 1 month before the due dates at 36, 37 weeks. It's true that women are having their babies at a later age, so they have maybe more health problems. And also it's true that there's a lot of obesity, and that complicates with sometimes high blood pressure, diabetes. That's true, and that's part of the problem. But there's also a lot of intervention. Why is there so many induction? And if your doctor is like, I'm not going to let you go past your day, I'm going to induce or offer to induce at, not offer, but say you should be induced at 29 weeks when there's no good reason, that's a sign that you're going to end up in a cesarean most probably. The problem with the cesareans is once you have a cesarean, it's not when a cesarean, always a cesarean. I was the go-to doctor for VBAKs because I had a VBAK myself. So, and I was kind of pushing my luck because at one point they say out of the VBAK, you get one rupture out of 200 VBAKs, and I was way over 200 because women were coming from very far to have a VBAK with Natalie because she understands she had a VBAK and everything. But I never had a rupture again. I got lucky, but we did it the right way. I did not induce on VBACs. We let and nature doses the contractions very well. The problem when woman is under epidural, and then you put pitocin and you up, there's strong contractions. That's when you can get a rupture because you're really like pulling on the scar. So usually nature will dose the contraction. So it's well done. So never had a rupture, but and there's also like a lot of doctors that say, "Oh, I'm pro VBAC. I'll let you," and then they find all the reasons, and then you have more repeat cesarean. Again, if your doctor says he's pro VBAC, ask around like the other women in the waiting room what happened. Ideally, you'll be referred to your healthcare provider by somebody who loved him or her, and you can consider a midwife. It's also a good thing to have a doula because then you have a doula is somebody who supports you in labor. She's not a midwife, she's not a doctor, so she doesn't do any medical diagnosis or treatment, but she can be your support. And I say she because I've never met a man doula, but that lowers your risk of having a cesarean. We'll talk about that in another video. So getting back to your doctor, I once saw a television interview in Argentina. The OBGYN was saying, I have a 90% cesarean rate, and he was proud of it. And he goes, ideally, and he had a little grin in his face, ideally it would be 100%, but some women come to the hospital, they deliver too fast. And I was, oh my God, like, he didn't care that it's dangerous to do unnecessary cesareans for the babies. And babies have often lung problem like respiratory distress because they're yanked out of the womb without the contractions pushing the liquid out of the lungs and all that stuff. Same thing, babies that were born by cesarean, they know for a fact that they don't have the right bacteria in the gut because they were not exposed to the mummy's vagina. So what you can do is you find out that your doctor has a very high cesarean rate and you're getting more uncomfortable. You can change doctor. Okay, that's one way. I've had a patient, another anecdote, Natalie. I've got a lot of anecdotes. So I've had a patient that transferred, and I was like writing the question. She was 39 weeks. So I see her for the first time. She waited for her appointment, so I called her from the waiting room. And I'm filling the questionnaire like, okay, is there inherited disease in your family? Did you ever have surgery and blah, blah, blah? Do you smoke? And sure enough, at one point I'm looking at her and I go, you seem to be like your face changes every 3 to 5 minutes. Are you having contraction? She goes, yes. And sure enough, I checked her. She's 5 centimeters dilated. So, and she just transferred to me. She did not know me before that. So I went to the hospital with her in the, she rode in my car. So if I was able to, I was ready to pull over if we did not make it to the hospital, but in my office was so close to the hospital, we made it. But we got there within an hour, she delivered. And then after that, I'm like, hey, nice to meet you. I'm Natalie, and I just delivered her baby. And then I went back to the office, and people clap. Oh, the baby's born. They are all excited. And in my mind, I was like, oh my God, she had such doubt about her doctor and her possibilities of delivering naturally, of being respected, that she took a leap of faith, took a perfect stranger, me. We ended up bonding and being, best friends or whatever. But how distressful could that be? Like you trust a perfect stranger. It could have been, I could have been an awful person. No, I'm not. But that bugged my mind, like, oh my God, it's kind of sad that she felt the necessity to transfer at the last second like this. Okay, I'm gonna stir the pot here. I'm gonna drop the bomb. So the National Bureau of Economics did a study, and they were saying that doctors who have incentives to do cesarean, they're paid like $100 more, will do more cesareans. It's a money thing, and in those cases, the hospital also receives a bonus. It's also convenient sometimes to say, okay, if I start a cesarean, I'll be home in an hour instead of waiting, because nature sometimes take her sweet times and it could be like going on for a longer time. I've seen again gynecologists saying, okay, there's like 5 patients on the board. I'm going to erase that board and cesarean, 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 and then, I'll be home in 5 hours and I'll be done for the weekend. There's more cesarean, by the way, on Friday evening, like around 5 or 7 p.m. because people want to clear the board. Okay. So it's frustrating to hear this, but it's a reality. The other motivation often for doctors, like what I was saying, is preventive, like um, they could get sued if they did not do a cesarean. And there's only one case of a patient suing the doctor because she did a cesarean. But all the other cases is like, why didn't you do a cesarean? So it's kind of defensive, but they're protecting themselves. And that we can only blame the system for people suing for. And I've heard of lawsuits for saying the wrong sex at the ultrasound. And at one point, one of our local hospitals stopped saying the sex at the ultrasound because of the lawsuits, which is like ruining it for everyone because one person was, you know, silly. In that same study from the Federal Bureau, they also noticed that if the patient herself was a doctor, she had a 10% less chance of having a C-section because she knew, I guess. And they compared it to if a garagist went to have his car fixed to the garage, he would get less. He was less susceptible to have procedures on his car sold to him because he would know, like, that's not necessary, my brakes are fine or whatever. So that's kind of scary to hear that if the doctor knows that his patient is a doctor, he will do less cesareans. That concludes my first tip. It was a long tip, but it's important. I think it needed to be said. My first tip to how to avoid a C-section. If you're not patient or you don't want to go through all the small videos tip by tip, there's a webinar where a masterclass where I go over all the tips, and there's different information. So you could go with all the little videos, all the tips, and you could attend the masterclass. It's free, and I reveal many, many tips. So I'm gonna put the link down below.